Hi everyone, this is Laura Patrone, and today we're going to talk about Bloom's Taxonomy Learning in Action using a ThingLink website, which allows us to put these little icons here and then have information. So today I'm going to use Bloom's Taxonomy to explain how, after learning the scanning protocol for a CT of the abdomen and pelvis, how students would be able to use different steps to apply this. So the first is, after learning the protocol, students will be able to identify the area that is being scanned, and they will write the scanning protocol in their books. And this is part one of Bloom's taxonomy, which will allow them to demonstrate the knowledge that they've learned. So step two, which is comprehension, students are going to explain and discuss what they will communicate to their patients about the scan. So students are going to explain what area we're scanning, how long the scan lasts, what area we're scanning, and anything that they need to tell their patients. So step three of this process is application. So students are actually going to go to their assigned clinical site at the hospital and apply the protocol to a patient for the proper procedure, and then they're going to actually produce the scan. So they're actually going to be scanning a live patient. And then step four, after they've scanned the patient, step four is analysis. Students are going to then examine their scan to ensure the protocol is completed properly according to the ART regulations and also according to the hospital's protocol. And then once the scan's completed, they're going to differentiate the different structures within the scan. So they're going to make sure that they have the diaphragms on. So when we're scanning a CT of the abdomen and pelvis, let me clarify, we are going to be scanning from the top of the diaphragm all the way through the symphysis pubis. So we're going to make sure that all our organs are on there, that the patient's liver, stomach, intestines, and kidneys and whatnot are all there, and we're going to take a look at them and differentiate between all those different structures. And the reason we're going to do this gets applied in step five, which is synthesis. Students are going to, first of all, generate reformatted images to help them hypothesize a diagnosis based on their scan. So they're going to be using both things here in step 4 and step 5 to help them make a diagnosis for the patient. So the patient came into the hospital for a scan for a reason. So students need to be able to hypothesize a diagnosis, because if it's something that is urgent and requires immediate care, they need to notify the radiologist and possibly the patient's doctor. So the last step here of Bloom's taxonomy when we're applying to this lesson is evaluation. So how are we going to evaluate this? The students learned how to do a CT scan of the abdomen and pelvis. So the last step in this process is students are going to critique and assess their scan for any abnormalities the patient might have and explain possibly how they can improve on their scan. So maybe the patient's liver was cut off and they had to repeat images, or maybe they didn't explain the scan adequately and the patient moved during the scan or did not understand the breathing instructions, or maybe their collimation was not appropriate and maybe they scanned too much. So students are going to get the chance to assess and critique themselves so they can improve and give the best scans to their patient. So this is Bloom's taxonomy, learning in action in a nutshell, on how we would apply it to a lesson in our classroom.